Welcome to part two of the laryngeal anatomy review. Again, I'm Steve Tasko, and I'll be narrating this. We left off last video looking at the laryngeal cartilages, and we can see in this particular view, this is a superior view, and what we see is we have the thyroid cartilage here, the cricoid cartilage here, posterior portion, and the arytenoid cartilages here and here. And you can see that the thyroid cartilage is sort of triangular shaped or has an angle. And this prominence here is a result of the coming together of these two lamina of the thyroid cartilage, giving an angle to it. And that's what we feel as a thyroid prominence, sometimes called the Adam's apple. Now this view here also adds a little bit more information for us. All of these cartilages are connected to each other by various kinds of connective tissue. An important piece of connective tissue, or pieces of connective tissue, are the conus elasticus and the vocal ligament. The vocal ligament is some connective tissue that runs from this vocal process of the arytenoid and runs anteriorly to connect to the angle of the thyroid cartilage. And there's one on the left and one on the right. And that's a thick tissue, but it also connects continuously with this sheet of tissue that then heads inferiorly and attaches itself around the margin of the cricoid cartilage. And so you can see what this is. This portion is referred to as the conus elasticus. And as you can see, what this is doing is that it creates, if you think of the tracheal ring here being quite large, it now turns this laryngeal system really into a valve, where the only key opening now through this region is through this small slot here between the vocal ligaments and the vocal processes of the arytenoid cartilages. This is referred to as the glottis. Now, of course, we're going to fill all of this in with tissue, but this region right here is now the only way to get from above to below the larynx, and that's critical because that's going to direct air through this spot. And this can be, if we can vary the position of these structures, we can then vary the size of the gap or the glottis. Now, when we actually look down into a laryngoscopic view, we see a number of features. When I say a laryngoscopic view, this is the way we mostly clinically evaluate. We are looking from above at the larynx itself. So if we go back to this previous picture, you can look at this. This is the bare bones. But if we cover that and fill that in with tissue, we end up with something that looks like this. We have a number of key structures that you're going to become familiar with as you review and look at laryngoscopic views, which we'll be doing throughout the semester. Let's first start with the true vocal folds. They are here and here. This is a view that is such that this is left, this is right, and you can see this is posterior and this is anterior. So the true vocal folds are here and here. This region in here, as I mentioned before, is the glottis. And then we have a pair of folds just superior, although it doesn't really look superior in this image because it's two-dimensional, and that's called the false or ventricular folds, and they're located here and over there. The arytenoid cartilages are located roughly right in here, and this should be clear from that last image that we saw. So the arytenoids are there and there. And what we're looking at right about here is the posterior pharyngeal wall. And right in this area here is the opening to the esophagus. The esophagus is just posterior to the larynx. And so that's what we're looking at there. Now we have a tissue that runs from the arytenoids all the way over to this structure here. This structure is the epiglottis. And this structure here that runs from the arytenoid to the epiglottis is referred to as the airy epiglottic fold. So airy for arytenoid, epiglottis. And that's an important structure because that combined with the lateral and posterior pharyngeal wall creates a space between these two on both the left and the right side. I'm just showing you the left, and that is called the piriform fossa, which has relevance for swallowing. And then finally, between the epiglottis and this region here, which is actually the base of the tongue, are two smaller kind of pockets as well that are relevant for swallowing, not so much for voice, and those are called the vallecula. So if we look on an actual image, which looks something like this, we can see now this is the true fold, glottis, false folds or ventricular folds, false folds. There's the arytenoid there, and here. This is the epiglottis is down here. This is the airy epiglottic fold, piriform fossa. The esophagus would be right about there, the posterior pharyngeal wall not in the view, about there, and then the vallecula would be kind of up in this region here, more anteriorly. So you need to get to know that very well because we're going to be looking at pictures like this all the time. Now, I'm going to briefly talk about the nerve supply to the larynx, and then we'll discuss some of the musculature that are involved in controlling the position of the larynx in the neck and also the position of the vocal folds. There's the main cranial nerve supply to the key structures within the larynx itself is the vagus nerve or cranial nerve 10. So it provides the motor and sensory supply to the larynx. It has two branches that are important. The superior laryngeal nerve, right here, which branches off fairly high. This is the vagus nerve here, and this is the vagus nerve on the right side. And we get a branch that comes off here, and that then further branches into an external branch which goes down and actually innervates a muscle called the cricothyroid muscle, which we're going to learn about. And then it has a branch that goes in and provides internal sensory innervation for all of the region just above the vocal folds. So that's the superior laryngeal branch, which has an internal and external branch. Then we also have something called the recurrent laryngeal branch. It's recurrent because it recurs. It tends to, here's the vagus nerve as it goes down, and on the left side it recurs by looping around the aorta and then coming back up along the tracheal margin of the trachea back to the larynx, where it then supplies all the other key small internal muscles responsible for controlling the vocal fold. On the right side, this recurrent branch loops around the brachiocephalic trunk, comes back up, and handles that innervation on the right side. This is important because the location of these branches are relevant and can be problematic or susceptible to damage during any kinds of surgery of the head and neck. For example, thyroid surgery is a very common source of having problems of laryngeal innervation, and you can see why. This is the thyroid gland sitting on the larynx. Normally it's not shown in many images, and you can see how it any removal or surgery to it could affect the nerves that run into that larynx. That's the end of this particular section, and we'll finish up with a third piece.